Good morning.
Morning.
I was I used to teach at university, so this comes naturally to me to greet first, and that's gonna be a hard habit to unlearn. But thank you for having me today. I hope what I'm going to share is going to be somewhat useful to you. But before I start, is the elephant still here? I hate elephants. Because I had a non-elephant for my PhD degree. So I really envy the previous speaker. But I took lessons from that because I thought, okay, this particular situation makes me visit my kitchen and look at all those sharp instruments. Each time I'm going to, and I would look and say, I could just finish this job once and for all using these sharp instruments. But I was still young. And I did have those unholy thoughts towards my supervisor. And now I know that those were bad thoughts. I shouldn't have had those thoughts. I'm not a murderer. But it helped because it taught me how to survive and love the unlovable. I realized that particular person had such a high work ethic that it shook me to my core. When you are in science, people tell you are not very dumb. So that can go to your head. So I knew that, I'm not very, I think I can understand things when I'm taught. But now when I did my PhD, I realized that it wasn't about being taught. It was about learning how to think. And that was a nice learning curve for me. And she shaped me to such an extent that I think I can survive almost anywhere because of the exceptionally high work ethic that she had. It helped that my father also had a black book in the house with about 7,000 rules. So my upbringing and my PhD as supervisor really made me what I today consider as a gift in my character, that I think I can survive almost any situation and I thrive. At least I think I do. Okay, so today I looked at this topic which we were given. And I must say, I liked it. I thought it's high time that we talk about these things. And in forums where we don't have to apologize for talking about such issues. They've already told you who I am. Those of you who are not from the Medical Research Council, this is the funding arm of the Medical Research Council that gives grants and scholarships. And they happen to trust me with that mandate. Do not go and call them to find out if they made a good decision. Anyway, now, when I thought, okay, how can I be impactful to somebody that doesn't know exactly what is going on in my mind as I sit in that office year after year, I thought, this question to me is in two parts. The first part is, who is supervising and mentoring black students? I think that's the question, to my mind, that has to be answered first before we go to saying to what end. And one of the previous speakers has already touched on what was going on in my mind about to what end. So to answer the first question, I thought, okay, I'm not sure which way this is going. Really, it is not going the way I thought. I went into an article that was written by a scholar, which you can go and look at. Kopano, I don't think this is working the way it should. Anyway, so when I asked myself, who are these people supervising our students? I thought it's an obvious answer. It is not us. That's the short answer. It's not us who are supervising our students. It is the people that had what we are today trying to attain. So it's a neither correct nor wrong answer to say that largely it is white people that are supervising black scholars. It's just fact. And this picture is what we now see in the places of education. You see the black students, but I'm interested in seeing these ones more. These are the ones that we do not see, the supervisors, the mentors, and so on. Somewhere between the first picture and the second picture, something happens, and then we don't see people coming into the second picture. And therefore, those people on your left continue being supervised by people that there may be a gap between them, and that's what we need to interrogate. So I think it's important that we do address this shortage of black South African academics, because research tells us that over 60% of the people that are sharing their skills, I don't mind about the knowledge, because knowledge is knowledge, but skills, how to think, how to absorb knowledge, what to do with the knowledge, that's where now you get the qualitative aspect of teaching, which is not a discrete, if you like, a piece of data. And that's what we have to interrogate. To my mind, I think those of us who now have this highest qualification, if you like, because you won't get another after a PhD, actually have an unwritten mandate. This mandate says that if you're a black professional with a PhD, it's actually not your PhD. It belongs to the country. It is an asset that you are supposed to look after, nurture, and make sure that something out of that grows such that other people benefit from it. Until we understand that as black professionals, we'll keep on coming back to this subject of saying, where are the black professionals? But we have the black students in the class, maybe not to the numbers that we want, but the ones that we have to nurture until we see them in our lecture rooms, in our laboratories, being professors, in the business space, leading conglomerates or whatever. But it is up to us, the few of us, and we are very few. I think there's a statistic that says that out of 1,000 PhDs who start off, only 2% graduate. So you can imagine, it's just, if you work in an academic situation like us, Medical Research Council or here, you forget how much of a scarce resource you are. There just are no black PhDs in South Africa. That's the bottom line. You won't see it because you're around them here, but we're talking about these 54 million people, close to 60 million now. So in my own space of our office, I have decided to take this as a personal mandate to me. Fortunately, my job makes it that much more easy because I am part of the decision-making core of who gets funding by the Medical Research Council. Now, I can't just take all the funding and give it to black people. I have to apply my mind to say that, how can we help black professionals emerge? That means that a whole mindset has to change for that to happen. Because if you just blindly get all these requests for funding and you happen to have the authority to make those decisions, well, then you'll go with the highest scoring candidate all the time. And 2 years down the line, you'll be part of the people or the sector of our population that is unwilling to contribute to what we are building as South Africans. Because the same picture is going to remain. Unfortunately, certain parts of our country, institutions and so on, we cannot but name them. For instance, if you get an application from UCT, you are not likely to find an error there. But now those who are placed in the position of supervising our students, which comes back to what Kopano was saying, you as a student, you as a young researcher coming into the research space, you have to accept that I do not have a mentor that perhaps I would have chosen or that looks like me, etc. So what am I going to do about it? My philosophy is the one that I just gave you about my supervisor. You manage upwards. Instead of being managed down, you manage upwards and make them understand that you are a different individual looking for different things that they probably don't have in their kitty, and therefore you will go out and find those things because you need to succeed. Because when you interrogate why they actually do what they are doing, I have to say, from where I sit and from the data that I interrogate on a daily basis, it's usually to their own personal gain. And can you blame them? Not really. They're in an academic setting. They need to emerge. They need to be able to say, I've graduated so many, or rather I have so many PhD students. Don't talk about how many I've graduated. I have so many PhD students. Most of them are black. Don't ask me which country they're coming from, they're black. So you probably have two different mandates. That's why I say it's up to you and I as a professional who happens to have a level of influence, and if you are a student, you also have a mandate to manage yourself and to manage upwards if needs be, because this mandate is too urgent for you to be just lackadaisical about it. You cannot afford that. I saw as a solution, which I just paraphrased here, to say until us in science councils, universities, and other influential organizations preemptively appoint black PhD holding South Africans, well, then we'll just continue where we left off. So now this brings another dimension that if you're a black professional, you can't just accept any position blindly. If you get into a position, it must be such, you must tell yourself that it's not for me. Somebody else must benefit from where I am. I'm so fortunate that I have 300 children, babies, if you like, in any given year. There are about 300 people that we processed. And they don't know it, but I actually love them. And this is not about color, because we still have quite a healthy percentage of non-black people funded by the Medical Research Council. But each one of them, I almost know each one's story, and I know their excellence. One of them is sitting right here in front of me, Nezi. So she's going to be successful because I saw something in her that Kopano saw, that she probably doesn't even know because of her age. But that's what, I'm not sure which speaker mentioned, that we have to help people to climb. I have chosen to lower my wings, which is what most of us who now have this PhD, lower your wings so that other people can climb on these wings. The mandate is too urgent to be not careful about it. So when you think, and all of this obviously is wrapped around this whole concept, big concept. Maybe it is an elephant, it's so big it's an elephant, transformation. It's a big word. I choose to think of transformation as a doing word. While we just talk, well then that's what it will remain. You'll find the definition and all of that, but until you reduce it into a doing word to say that I've had this opportunity as a black person, whether as a student or as a professional, how do I ensure that at the end of a year, a financial year, somebody has benefited from me directly? Then you are not contributing to this agenda that is so urgent in our time in South Africa. And so that's basically what I think I want to share. Now, it's interesting when people come to look for funding at MRC, they look at the name, and I get two sorts of responses. One, oh, who is this? Dr. Martin? I say, no, Maitin. Oh, okay, I'm looking for funding. But another response is, oh, finally. You know, we used to have some I don't know what the name was, Tandi something. And then I know that, okay, this is a teachable moment. This Maitin is actually Thabi. And then we level the playing field. And then we both get the correct tone now, because there are assumptions that are made in South Africa because of your name. People then think you're something you're not. And they sometimes get disappointed. But some get afraid to talk because they're so used to say, oh, I probably won't get cooperation because of the name. So one of my interesting teachable moments is to show people that there's not much to your name. My surname could have been Elephant, and it would still be me. So it's until they see that that one is misleading to everybody, because until you unpack that T, you make all sorts of assumptions. So the other thing that I would like to just emphasize is intentionality. At every level, I have been fortunate to have been part of the turning around and crafting certain products for funding that I could say were selfish to the mandate that's going on in my head. We have these, which you can go and look at them. I'll just briefly show you. These are serious funding packages, but all of them are geared to this question of today. And I am enjoying a lot of flack from all over the country for why are we having these now? Why are you funding like this? The first one is where we decided that we need to ring fence previously disadvantaged institutions. I hate the term because it's basically, but it's quick for you to understand what I'm talking about. These are just universities that didn't have the kind of funding that other universities enjoyed. So now we've got ring-fenced millions that were given to 8 universities every single year. And then inside that particular university, the researchers compete, and they can get up to $1 million per researcher every year. Why are we doing this? So that in 5 years' time, those universities should have researchers who are smart but didn't have funding to now have come up. The mid-career scientists is where some of you might be basically coming up to. These are black professionals who are there at universities like I was teaching, which you call lecturing just to sound fancy, but it's still the same thing, who don't have funding, but you can see that there is so much potential in them, and therefore we give them each about 1.5 million every year. This is an initiative that is not very popular in some quarters for obvious reasons. Who is this person that's so excellent and we have to give them 1.5 million every year? And then the intramural postdoc, again, is another program that answers the question of today. Because for a long time, the Medical Research Council has been considered correctly as somewhat elitist. So this program, we are saying in it, okay, let's stop now. Let's do something practical. Let's put let's get our hands dirty and change this. So now we are getting black PhDs to sit inside the units. How many units do we have, Kopano? About 13. That's Intra, and then yeah. So now each of those units is supposed to host at least 2 PhD students, so that come time of retirement of the unit director, we don't look around to say, oh, okay, now we have to import somebody. We need to grow people from inside. And the last one is a program that is managed by Joreen, who's with me here. That's the one where we fund everybody, generic black people within South Africa, basically, again trying to close the gap. And to come back to what I was saying, Joreen joined our division when she had, shall we just say, modest qualifications. And I said to her, I don't work like that. People around me study. So you are going to study. Who knows, maybe by the time I retire, you'll be heading the division. So I'm so happy to say that she's studying, she's excited about it, she is getting excellent marks. But that's what I mean by saying, put your money where your mouth is. Let people see that you are a PhD, but you have PhDs coming up because of you. I thank you so kindly for your time.